All right, so part of the OB Bootcamp includes being able to identify and recognize certain things in fetal heart rate and fetal strips. So just a quick 101, when looking at a fetal heart rate strip while you're on the unit, you need to be able to understand and differentiate the difference between fetus and maternal. So the bottom is always going to be maternal. This is where you're going to see the contractions, okay? When looking at maternal contractions, we will use either two devices. We're going to use either a toco or a tachometer. This is an external monitor that goes on the mother's abdomen, and this will tell us how frequent mom is contracting and how long or duration of her contractions are lasting. Then there's also a monitor device called an IUPC. This is an intrauterine pressure catheter, and this is inserted internally into the mom once her bag of water is broken, and this can tell us actually how strong contractions are lasting. All right, so what you need to know is frequency of contractions. Frequency is measured in minutes. It's always going to be measured in minutes. And it is measured from the start of one contraction to the start of the next contraction, okay? Then you're gonna look at duration. So I tried to space it out on here for you guys. Duration is always gonna be documented in seconds. And this is telling us how long a contraction is lasting. So from the start of the contraction to the end of the contraction. Okay, then you're gonna look at the top. The top half is always gonna be baby, all right, or fetal heart rate. And you're gonna see this abbreviated as FHR. The normal fetal heart rate is between 110 and 160. So anything less than 110 beats per minute would be considered bradycardia. Anything above 160 beats per minute would be considered tachycardia for an infant. We're going to monitor the baby with either an ultrasound. This is the external device that goes on the mother's abdomen, or if we needed to measure internally, we could put what is called a fetal scalp electrode, which is also abbreviated as FSE. The mother's water has to be broken for this. And we screw the little piece onto the baby's head, and it's basically like a continuous EKG of the baby. All right, so next you're gonna see on the monitor a line. Hopefully it's pretty squiggly, and that's called variability, and we're gonna talk about that in a couple of minutes. But first I just want you to see how there's gonna be ups and downs. You're gonna want to imagine that you have an imaginary ruler, and you would draw that line through what would be the average heart rate, and this is what we're going to call the baseline. All right, so if you look closely, there's a really faint gray line, and it's kind of the median line of all the baby's heart rate, and this would be called my baseline, and this is where I'm getting the number between hopefully 110 and 160. The baseline is always going to be recorded in 5, so it's going to be measured as like 120, 125, 130, 135. You're never going to document it as like 136 or 137. So once you have determined the baseline, which we'll go ahead and say this baseline is 140, all right? You're going to want to look for beats above the baseline, all right? So when there's an abrupt increase above the baseline, going 15 beats above and lasting for at least 15 seconds, we call this an acceleration, all right? So 15 beats above the baseline, so this is going up to about 155. We said the baseline was 140, and it's lasting for 15 seconds. This is called an acceleration. This can occur at any time during labor with or without contractions, and this is a positive sign for the baby. This means that our baby is well oxygenated and is doing good. All right, so as you can see, this can happen with or without contractions, and it is a sign for oxygenation. Now, if you look at this next on our monitor strip, we have a contraction down below, and you can see that the baby's heart rate gradually decreases and is mirroring this contraction. This is called an early deceleration, all right? Early decelerations occur when there's head compression. This is a vagal response of the baby. It happens as baby is descending through the maternal pelvis, and as things get closer towards birth, sometimes labor and delivery nurses will start seeing these gradual decreases in the fetal heart rate below the baseline, mirroring the contractions, called an early deceleration. This does not require intervention. The only thing you may need to do as a labor and delivery nurse is go in and assess the progress of labor of your mom and making sure that labor is not imminent and that you need to set up a delivery table or calling the doctors or anybody else on the OB team that needs to be present for the birth of the infant. Then as we continue to go down our fetal monitoring, we're seeing our variability, and all of a sudden you see an abrupt decrease in the fetal heart rate. The onset and return to baseline can vary with contractions. So this might happen with the contraction, this might happen before contraction, somewhere after contraction's over. It just kind of depends on what's going on with the baby. From the baseline to the nadir, or the bottom of the decel, is less than 30 seconds. This is called a variable deceleration. Variable decelerations occur because of cord compression. So you have to think somewhere the baby's umbilical cord is being compressed, and when that umbilical cord compression happens, it causes an abrupt decrease in the fetal heart rate, causing the variable deceleration. This does require an intervention, and the most least invasive intervention for a mom is a position change. All right, so you got to think something internally is causing compression on that umbilical cord. We turn our mom to a different side, or maybe put her on her hands and knees, and that relieves the compression on the umbilical cord. And then the heart rate can return to baseline and keep going in labor. Then we're going a little bit more. Mom has another big contraction, and all of a sudden we start to see a gradual decrease in the fetal heart rate that is occurring after the onset of the peak of the contraction. All right, and then the the nadir of the decel happens after the peak, and then it returns to baseline. Unlike the variable deceleration, this is a gradual decrease. So the gradual decrease is more than 30 seconds. And again, the onset occurs after the peak of the contraction. All right, so think there's a contraction, the decel is coming late, so it's a late deceleration. Late decelerations occur because of uteroplacental insufficiency. So for some reason, the blood flow from the placenta to the baby is being disrupted, okay? And so this is going to require an intervention as well.